This presentation is for Mr. Lane. Mr. Lane is a 53-year-old male who was recently diagnosed with depression. He has been prescribed the drug fluoxetine, and this presentation will be discussing what it does, potential side effects, and strategies to avoid worsening potential side effects. Good morning, Mr. Lane. My name is Kayleigh, and I'm a student nurse here to discuss with you about your newly prescribed medication, fluoxetine. Now, Mr. Lane, I am here to help you. If you have any questions at all, please do not hesitate to ask. I'm happy to clarify anything that you may feel unsure about. For your leisure, this is just a small PowerPoint to highlight some of the key points for you, and if you like, I can provide a copy for you to take home. So has anyone discussed with you exactly what fluoxetine is and how it will help you? No? That's okay. Together we will be discussing what it does, how it's going to help you, potential side effects, dosages, and some strategies to help you for when you go home. That way, if you have any questions or unsure about anything, we are here to support and help you. As reviewed by Dr. Sydney, we want you to think of fluoxetine as a safety net to help assist you with your everyday activities. Your care plan states that you are experiencing some tiredness, low energy, and you are just struggling to find enjoyment in your everyday tasks, correct? Well, Mr. Lane, this medication is designed to help you with the low energy and the mood changes you are currently experiencing. Fluoxetine releases a hormone called serotonin, which gets transmitted to your brain's central nervous system. You may have also heard it as the happy hormone. It'll help make sense of some of the unexplained emotions you are currently experiencing and will help you get back on your feet. In the end of the day, that is our main goal here. Your happiness and safety is incredibly important to us. In saying that, we want you to be aware of some of the common but rarer potential side effects that may come with this medication. Common side effects you may experience could be slight nausea, headaches, a bit of fatigue, like trouble sleeping, or just feeling tired or weak. It's common that you'll experience these side effects for the first week on the medication, but it's important that you regularly set up an appointment with Dr. Sydney to discuss your progress while you're on this medication. This is to ensure we can track your progress and how your body is reacting to it. Although those are the more common symptoms, there are some more serious and potential side effects we need to be aware of. The more rare side effects, but the ones to be aware of, is tightness in your chest or finding it potentially hard to breathe. Painful erections that could last for more than 2 hours. This can be included during sexual intercourse and without. Sex drives are also known to decrease while on this medication. Seizures, headaches, or having trouble recalling things, and severe bleedings from cuts that you're unable to stop within minutes are two side effects to be aware of. Symptoms like seizures and fevers and diarrhea may be a result of serotonin syndrome, when your body is receiving too much serotonin. This can be found in patients who are taking other medications alongside fluoxetine. Although Dr. Sydney is aware of medications you are currently on, if another medication pops up, please book an appointment to see Dr. Sydney before commencing this medication. Fluoxetine doesn't mix well with other medications and can make potential side effects worsen. Serotonin syndrome can be fatal, so calling 000 is recommended if serious symptoms like these continue to occur. Keep in mind that these side effects may seem daunting to hear, but Dr. Cindy and I will work alongside you to monitor and track to see how your body is coping and if we need to find an alternative option. In the meantime, I'd love to give you some strategies on how to prevent or assist with potential side effects that you may be experiencing. I recommend drinking heaps of fluids to avoid headaches. I personally love having my water bowl next to me because it's a continuous reminder for me to drink water. It's recommended to drink at least 3.7 liters a day. Headache symptoms are commonly known to dissipate after a week on this medication, which is excellent news. It's important to remember that exhaustion and feeling tired is normal, but ensure that you know your limit. If you're tired, please avoid driving or doing any physical activity which may cause harm to yourself or others. We will discuss in 2 weeks your level of fatigue because this should only last a few weeks of taking this medication. If side effects such as this occurs, we will look at decreasing the dosage or finding an alternative option that suits you. Feeling nausea is a common side effect too, so it is advised to take medication with your morning or evening meal whenever you take it. Dr. Sydney has informed me that we are beginning your fluoxetine dosage at 20 milligrams. Is this correct? Okay, awesome. It should be taken once a day. It isn't required to take the medication with food, though it is highly recommended. We understand life can get busy, so if you do miss a dose of medication, don't worry, just take it as soon as possible. It is important to note that if your next dose is due soon, don't double dose. It's best to leave it and continue with your regular dosage. Do not stop taking fluoxetine until advised by Dr. Sydney either. Withdrawal symptoms can occur, such as feeling nauseous, shaking, headaches, dizziness, and trouble sleeping. This can be prevented, so discuss with Dr. Sydney before considering stopping this medication. We will assess over the next few weeks on how you feel and see if we need to adjust the dosage based on your progress, but so far, only take 1 tablet a day, which is 20 milligrams. I do understand that there is a lot to consider and digest. Only 1 in 10 people experience 1 or more of these common side effects listed, so you are in good hands, and we will be monitoring your progress. Mr. Lane, we understand that this may be overwhelming for you, but I hope this small amount of information has been helpful for you to understand what exactly you are taking and how it will be such an asset to your health. Do you have any questions or concerns? No? That is totally okay. I'll let Dr. Sydney know that I've had this discussion with you, and he'll come by later to check up on you and make sure everything is okay. Sounds good? Okay, awesome. Thank you so much for your time, Mr. Lane.